Go ahead and swallow once, right now. Then pay attention to the back of your throat. Does it feel like something is stuck there? Maybe you've been clearing your throat over and over, but that thick mucus never really seems to go away. If that sounds familiar, you're not alone. I hear this concern from patients all the time. What surprises many people is how slowly it develops. It doesn't usually appear overnight. Instead, it builds up little by little until one day you realize you've been clearing your throat for weeks, months, or even years. Because it happens so gradually, most people can't remember exactly when it started. Many assume it's just another part of getting older. They think it's something they simply have to live with. But that's not how I look at it. A symptom that stays with you day after day is your body's way of asking for attention. It may seem small, but it usually has a reason behind it. In this video, I'm going to walk you through the 5 most common causes of persistent throat mucus in older adults. These are the causes I want my own patients to understand, because they often go unnoticed. Even more importantly, 2 of these causes frequently occur together. When they do, they can make the problem much more frustrating and much harder to recognize if you're only looking for a single explanation. I'm a physician, and my goal today is to help you understand what your body may be trying to tell you in simple, practical terms. Before we get started, I'd like to hear from you. How long have you been dealing with this constant throat mucus or throat clearing? Let me know in the comments, and then let's go through each possible cause together, one step at a time. Before we talk about the specific causes, there's one important thing I want you to understand. Mucus is not your enemy. Your body is supposed to make it every single day. In fact, it plays an important role in protecting your airways. It helps trap dust, bacteria, viruses, and other tiny particles before they can reach deeper into your lungs. The real problem usually isn't that your body is making mucus. The problem is whether your body can clear it away the way it's supposed to. Under normal conditions, your airways have millions of tiny hair-like structures called cilia. They work around the clock, moving mucus upward so you can swallow it or clear it without even noticing. Most of the time, this process happens automatically. You never have to think about it. As we get older, that system doesn't work quite as efficiently as it once did. The cilia tend to move more slowly, so mucus stays in the throat and airways longer than it should. It has more time to build up, which is why you may notice yourself clearing your throat more often than you used to. This also explains why the same amount of mucus that wouldn't have bothered you years ago may suddenly feel much more noticeable after the age of 55. Even a small increase in mucus production can become frustrating when your body's natural cleaning system has slowed down. That's why it's so important to look beyond the mucus itself. The question isn't simply, why do I have mucus? The better question is, what's causing my body to produce more of it, or making it harder to clear? Once you understand that difference, the rest of this conversation becomes much easier to follow. Now that we've covered the foundation, let's look at the 5 most common reasons this happens, and start with the one that is probably overlooked more than any other. The first cause is probably the one that gets overlooked more than any other. It's called silent reflux. Unlike the kind of acid reflux most people know about, silent reflux often doesn't cause the burning sensation in the chest that many people expect. That's exactly why so many people never connect it to their throat symptoms. As we get older, the valve between the stomach and the esophagus can become a little weaker. When that happens, small amounts of stomach acid can travel upward. Instead of staying in the lower part of the digestive system, the acid reaches the back of the throat and the voice box. Even if it's only a small amount, those tissues are much more sensitive than the stomach itself. Your body reacts the way it always tries to react when something is irritating delicate tissue. It creates extra mucus to form a protective layer. The mucus isn't the problem. It's actually your body's attempt to protect itself from ongoing irritation. This is why many people wake up in the morning feeling like something is stuck in their throat. They clear their throat again and again, but the feeling quickly comes back. Because they don't have heartburn, they rarely think their stomach could have anything to do with it. In many cases, that's exactly what makes silent reflux so difficult to recognize. Take a moment and think about your own symptoms. Do you notice the mucus is worse first thing in the morning? Does your throat seem to need constant clearing even though you don't feel sick? Have you ever noticed the sensation becoming more obvious after lying down for the night or after bending over? If any of those sound familiar, silent reflux could be playing a role. The good news is that this problem can often be improved once you recognize what's causing it. I'll show you some simple steps later in the video that may help reduce this type of irritation without making your daily routine complicated. For now, the important thing is simply recognizing the pattern. There's one more detail that's worth keeping in mind. Some common anti-inflammatory pain medications can make silent reflux worse in certain people. If you're taking these medications regularly, they may be adding to the irritation without you realizing it. That doesn't mean you should stop taking any prescribed medicine on your own. It simply means it's another piece of the puzzle to be aware of as we work through the possible causes. Now let's move on to the next reason. Persistent throat mucus is so common, especially as we get older. The second possible cause is something called postnasal drip. This is another condition that becomes more common with age, but it doesn't always look the way people expect. Many people imagine a sinus problem means a stuffy nose, facial pressure, or frequent headaches. In reality, chronic sinus inflammation in older adults can be much quieter than that. You may be breathing normally. Your nose may not feel completely blocked. You may not have much sinus pain at all. Yet throughout the day, mucus can slowly drain from the sinuses down the back of the throat. Because it happens little by little, you may not even notice it. What you do notice is the constant need to clear your throat, or the feeling that something is sitting there and won't go away. This is one reason so many people mistake the problem for seasonal allergies. They reach for allergy medication, hoping it will dry everything up. But if the real issue is ongoing inflammation inside the sinuses, those medications may not solve the problem. In some cases, they can even leave the mucus feeling thicker, making it seem even harder to clear. Instead of focusing only on drying the mucus, it often makes more sense to help your body's natural cleaning system do its job. One simple approach that has been studied for this purpose is rinsing the nasal passages with a saline solution. The goal isn't simply to wash mucus away. It also helps reduce irritation inside the nasal passages and supports the natural process that moves mucus where it belongs. Remember the tiny hair-like structures we talked about earlier? They work best when the environment inside the airways stays healthy. Supporting that natural cleaning process can make a real difference over time. The important word here is time. This isn't something that usually changes after 1 or 2 attempts. Like many healthy habits, the benefit comes from doing it consistently. Giving your body enough time to respond is often just as important as the method itself. Later in the video, I'll show you how this simple step can fit into an overall plan for reducing persistent throat mucus. For now, just remember that if you've been treating this like an allergy without much success, chronic sinus inflammation and postnasal drip may be another possibility worth considering. Now let's move on to a cause that surprises many people because it may have nothing to do with the throat or the sinuses at all. The third possible cause often catches people completely by surprise. It isn't a problem with the throat. It isn't coming from the sinuses. In some cases, it may be related to a medication you've been taking every day. More specifically, certain blood pressure medications known as ACE inhibitors. For some people, this group of medications can irritate the throat as a recognized side effect. It's important to understand that this is not an allergic reaction. It doesn't mean the medication is unsafe or that your body is rejecting it. It's simply one of the known ways these medications can affect certain individuals. One of the reasons this connection is so easy to miss is timing. Many people expect a medication side effect to appear within a few days of starting treatment. But with ACE inhibitors, throat irritation and frequent throat clearing may not develop until weeks or even months later. By that point, most people have stopped thinking about the medication altogether. Instead, they assume the mucus is coming from aging, allergies, or something they recently caught. I've spoken with many patients who were convinced their symptoms had nothing to do with their prescription because they had been taking the same medication for quite some time. That's exactly why this possibility is often overlooked. The longer the delay between starting the medication and noticing the symptoms, the harder it becomes to connect the two. If this sounds familiar, take a moment to think back. Did your throat symptoms begin around the same period that you started treatment for high blood pressure? The timing doesn't prove that your medication is responsible, but it may be a useful clue that deserves attention. If you notice that the timeline seems to match, The next step is not to stop taking your medication on your own. Instead, bring it up with your doctor or pharmacist. They can review the specific medication you're taking and help determine whether it could be contributing to the irritation. Sometimes, simply recognizing this possibility leads to a much more productive conversation about your symptoms. The important message here is that persistent throat mucus isn't always caused by something happening inside the throat itself. Occasionally, the answer may be found somewhere completely unexpected. Now, let's move on to another cause that is much more common than most people realize, and surprisingly easy to overlook. The fourth possible cause may sound almost too simple, but it's actually very common. It's dehydration. Many people don't realize just how closely the amount of water in your body is connected to the way mucus feels and behaves. Mucus is made mostly of water. When your body has enough fluids, it stays thinner and moves more easily through the airways. But when you're even slightly dehydrated, the mucus becomes thicker and stickier. That makes it much harder for your body's natural cleaning system to move it out of the throat. Think about the difference between water and maple syrup. Water flows easily. Maple syrup moves much more slowly because it's thicker. Mucus behaves in a similar way. When it becomes too thick, it tends to cling to the back of the throat instead of clearing naturally. That's when you may find yourself clearing your throat over and over, even though very little seems to come up. One reason this becomes more common with age is that our sense of thirst gradually becomes less reliable. Many older adults simply don't feel thirsty as often as they did when they were younger. As a result, they may spend much of the day mildly dehydrated without realizing it. They aren't intentionally avoiding water. Their body just isn't sending the same strong signal that it once did. That mild dehydration may not seem like a big problem, but over time, it can make persistent throat mucus much more noticeable and much harder to clear. This is why waiting until you feel thirsty isn't always the best approach. Drinking water consistently throughout the day gives your body a better chance to keep mucus at a healthier consistency. Small amounts taken regularly are often more helpful than trying to drink a large amount all at once after you've already become dehydrated. It's a simple habit, but sometimes the simplest changes can support your body's natural cleaning system more than people expect. Now let's move to the fifth and final cause, one that many people have never heard connected to throat mucus before. The fifth and final possible cause is probably the one that gets talked about the least. At first, it may not seem like it has anything to do with your throat at all. It's the health of your gut microbiome. Over the past several years, researchers have learned that the digestive system and the respiratory system are more closely connected than we once believed. One of the ways they communicate is through the immune system. That means changes in the gut don't always stay in the gut. In some cases, they can influence how the body responds in other areas, including the airways. When the balance of healthy bacteria in the gut is disrupted, the immune system may respond differently. That response can contribute to ongoing inflammation. As inflammation increases, the airways may produce more mucus, even though the throat itself isn't where the problem began. This is one reason some people continue to deal with persistent throat mucus, even when they can't find an obvious problem in the throat or the sinuses. You may hear this connection described as the gut-lung axis. It's a term researchers use to describe the relationship between the digestive system and the lungs through the immune system. Growing research has helped us better understand this connection, and why looking at only the throat doesn't always provide the complete picture. So what can disturb the balance of the gut microbiome? Several everyday factors may play a role. Eating too little fiber over time can reduce the diversity of beneficial bacteria. Frequent use of antibiotics may also affect that balance, because these medications don't only target harmful bacteria. A diet high in added sugar may make it harder for healthy bacteria to thrive. Long-term stress can also influence the gut in ways that affect the body's normal immune response. None of this means the gut is the only cause of persistent throat mucus. But for some people, it may be one piece of the puzzle that has been overlooked. That's why simply trying to soothe the throat doesn't always solve the problem if the source of the irritation is beginning somewhere else. The encouraging news is that there are practical ways to support gut health as part of an overall plan. In the action plan coming up next, I'll walk you through a few simple habits that can help address this possibility, along with the other causes we've discussed. Before we move on to what you can do about persistent throat mucus, I want to make one important point. The good news is that most cases are not caused by a serious medical condition, and many can improve once the underlying cause is identified and addressed. That said, there are a few warning signs that should not be ignored. If you notice blood in your mucus, increasing difficulty swallowing, unexplained weight loss, a lump in your neck, or hoarseness that doesn't go away, it's important to see a healthcare professional as soon as possible. These symptoms don't automatically mean something serious is wrong. However, they do deserve a proper medical evaluation rather than home treatment alone. The goal is to identify the cause early and make sure nothing more significant is being overlooked. If none of those warning signs apply to you, then let's focus on the practical steps that may help. In the next section, I'll walk you through a simple action plan that brings together everything we've discussed so far and shows you where to start. Now let's bring everything together into a simple plan you can actually follow. The goal isn't to change everything overnight. It's to make a few practical adjustments that match the possible causes we've discussed. If silent reflux may be contributing to your symptoms, start by looking at your evening routine. Try not to eat within about 3 hours of going to bed. That gives your stomach more time to empty before you lie down. While you're sleeping, keeping the head of your bed slightly elevated may also help reduce irritation during the night. Instead of stacking extra pillows under your head, focus on raising the upper part of your body so you stay in a more comfortable position while you sleep. Next, pay attention to hydration. A simple habit can make a difference. Drink some water in the evening, and make it a habit to drink water again after you wake up in the morning. Just as important, continue drinking water regularly throughout the day instead of waiting until you feel thirsty. Keeping your body well hydrated gives your natural airway cleaning system a better chance to work the way it was designed to. If postnasal drip seems like a possible cause, consider making saline nasal rinsing part of your regular routine. The key is consistency. Don't judge the results after only a day or two. Give it at least 2 weeks before deciding whether it's helping. Supporting your body's natural cleaning process takes time, and steady habits usually produce better results than occasional treatments. If you think your symptoms may have started after beginning a blood pressure medication, don't ignore that possibility. At the same time, don't stop taking any prescription medication on your own. Instead, make a list of everything you're currently taking and review it with your doctor or pharmacist. They can help determine whether one of your medications could be contributing to your throat irritation and advise you on the safest next step. If gut health may be part of the picture, look for simple ways to support your gut microbiome through everyday food choices. Including fermented foods in your diet can be one practical step. The goal isn't to make dramatic changes overnight. It's to build habits that support a healthier balance over time as part of your overall routine. Finally, remember that hydration isn't something you fix once a day. It works best as an ongoing habit. Drinking water consistently throughout the day helps support healthy mucus consistency and makes it easier for your body's natural clearing system to do its job. What I want you to remember most is that these steps work together. Each one addresses a different possible cause we've discussed. You don't have to be perfect, and you don't have to change everything at once. Small, consistent changes are often much more effective than trying to do everything for a few days and then giving up. Give your body time to respond. Pay attention to how your symptoms change over the following weeks. Improvement often comes gradually, just like the symptoms developed gradually in the first place. Staying consistent with these simple habits gives you the best opportunity to reduce persistent throat mucus and better understand what your body has been trying to tell you. Before we finish, let's briefly talk about a few home remedies that people often ask about. First, honey. Honey may help soothe an irritated throat and make you feel more comfortable for a while. However, it's important to remember that it doesn't address the underlying cause of persistent throat mucus. It may ease the symptom, but it doesn't solve the reason the mucus is there in the first place. Another common question is about milk. Many people believe that drinking milk creates more mucus. Current evidence doesn't support that idea. Milk does not actually increase mucus production. That said, some people notice that mucus feels thicker after drinking milk. While the amount of mucus hasn't changed, the texture may seem different, which can make the sensation more noticeable. Finally, a word about apple cider vinegar. If silent reflux is contributing to your throat irritation, Using apple cider vinegar may actually make your symptoms worse rather than better. That's why it's important to understand the likely cause of your symptoms before trying popular home remedies. The best results usually come from treating the cause, not just trying to relieve the feeling. Let's quickly review what we've covered. Persistent throat mucus is not simply something you have to accept as part of getting older. In most cases, there is an underlying reason for it. Today we talked about 5 of the most common possibilities: silent reflux, postnasal drip, certain blood pressure medications, especially ACE inhibitors, mild, ongoing dehydration, and changes in the gut microbiome. Each of these causes can contribute in a different way, and each one has practical steps that may help. That's why it's so important to look beyond the mucus itself, instead of trying to hide the symptom. Think of persistent throat mucus as a message from your body, not just an annoyance. The more you understand what may be causing it, the better prepared you'll be to choose the right approach and take meaningful steps toward improving it. Remember, meaningful improvement usually takes time. Small, consistent changes often make the biggest difference. If you'd like to learn more about how gut health affects your overall health, be sure to watch the next video. And if this discussion helped you, I'd love to hear about your experience in the comments. Take good care of yourself, and I'll see you next time.